In the first part of this video, I will explain the main reason we need vitamin D, especially supplement. In the second part of this video, I will make it clear when we need vitamin D, because too much vitamin D can be more dangerous than vitamin D deficiency. Starting with the first question, why we need vitamin D? First of all, how vitamin D become part of our daily life. In 1920s, scientists were studying rickets, a disease in children that causes weak, soft deformity bones due to inadequate mineral settlement in bones. They noticed some foods like cod liver oil can cure rickets. They also noticed children with rickets get benefit from sun exposure, so they called this substance that present in foods come from sun exposure and cure rickets, they called vitamin D. This is how vitamin D is discovered. Nowadays, we know the exact structure of vitamin D, how it is synthesized in skin during sun exposure, which type of food contain more amount of vitamin D, and how vitamin D absorb calcium and phosphate from intestine and kidney, bring them together, make it pair, and let this pair of minerals settle in the bones to make the bone rigid and strong. In case of inadequate vitamin D or vitamin D deficiency, this process works in reverse direction. This mineral leaves the collagen fibrin of bones to maintain calcium level of the blood. By the time bone become weak, soft, in children we call it rickets, in adult we call this disorder osteomalacia. So the main reasons even nowadays that we use vitamin D supplement, especially in early childhood, is to prevent rickets and developmental problem. Although vitamin D have many other functions in our body. For example, it help our immune system to work more efficiently. It improve insulin sensitivity and help diabetic patient. It make muscle strong by maintaining calcium level, and even it affect our mood because we have vitamin D receptors in the brain as well. The second question, when we need vitamin D? We know vitamin D move with fat in the body, therefore we call it is a fat soluble vitamin. The excess amount of this vitamin is stored in liver. So when we don't get adequate vitamin D on daily basis, we use this stored vitamin D. It can last for few weeks to few months, depend on the amount. In early childhood, because the baby have rarely sun exposure and the breast milk don't contain adequate vitamin D, in many countries vitamin D supplement is routinely given to this age, starting from the first week of life until at least 12 months of life. In some countries like Germany, they continue through the second year of life as well to prevent developmental problem. After second year of life, usually vitamin D supplement is not routinely given. It depends on the person's condition. If the persons have about 10 to 20 minutes of sun exposure 3 to 4 times per week without sunscreen, this is enough for adequate vitamin D synthesis in the skin, especially if this person consumes vitamin D rich foods like fatty fish, mushroom, egg yolk. He did not need vitamin D supplement. But if the persons have rarely sun exposure and did not consume these types of food that contain good amount of vitamin D on regular basis, and they complain from fatigability, muscle pain, bone pain, it is better to do a blood test to check the vitamin D level. The test will give two important information. First, whether there is vitamin D deficiency or not. Second, if there is deficiency, whether it is mild, moderate or severe. Depending on the result, how long and how much vitamin D supplement is necessary will be clear. Because this is an important broad topic, feel free if you have any question about this topic. Stay healthy. See you in the next video.